Dear viewers, welcome to NASCOM Insights Vision Talks. What are Vision Talks? These are unique leadership interviews that emphasize strategic, future centric directions for a sector or an industry that is essential for India's shift to a developed nation. India's journey to become a $30 trillion economy by 2047 places healthcare at the center of transformation. Technology, especially AI, is revolutionizing diagnostics, treatment personalization, and patient outcomes, addressing challenges of accessibility, affordability, and quality. However, there are many hurdles to overcome, and transforming healthcare will require specialist organizations with a vision to advance health equity through innovation and partnerships, which is exactly the mission statement of PATH. In today's episode, we are excited to host Mr. Ankur Mutreja, Director of Partnerships, Communications and Strategy at PATH. What all does PATH do? We will hear that from Ankur himself. Welcome to NASCOM Insights, Vision Talks, Ankur.
Thank you so much. It's a pleasure being here on this platform. Thanks for having me.
So Ankur, do share a brief background about yourself, your career so far, education, what brought you here, your inspiration, role models, and also talk a little bit about PATH because I think the audience maybe would want to know what exactly PATH is all about.
Thank you. I've had quite an unorthodox career. I started as a microbiologist, so a very technical background to start with. And after that, I got really interested in the industrial side of the biotech world. And so I decided to take up industrial biotechnology following that, where I learned a lot about how large-scale drug manufacturing happens, how vaccines are manufactured and formulated. So I moved, in that space of industrial biotechnology, worked in large-scale antimicrobial production. Following that, I became really interested in the public health side of things because I really wanted to see how things that are produced in these large industries get made and get distributed to people where the impact is felt. So I moved into doing public health, where I studied outbreak spread and transmission, which is again slightly technical, slightly public health, slightly impact, slightly social and behavioral change aspect. So after moving into that, I realized I need to learn a little bit more about how vaccines are creating their impact. So I then moved into proper industry. I worked for Novartis and American Health Interest Partnership Company for a few years before moving into academia. So I've sort of played ping pong with my career, starting from microbiology to industrial biology to public health, then into academia, where I led large research groups both in India and in the UK. And after that, I got picked up by an organization called CEPI that was working in epidemic preparedness, where we were responsible for funding a lot of vaccine R&D and manufacturing around the world. So we played a pivotal role during COVID in particular, and continue to do so for other diseases. And after working for a few years in that organization, I became really interested in the development sector, or how the funding that is implemented, that reaches development organizations, gets implemented. So PATH as an organization was and has been doing some phenomenal work in that space. And in discussion with PATH, we landed on this role, which I'm currently on, which is looking after the strategy, partnerships, and communications of the whole organization. And I'm responsible for ensuring that all the development work that we do is in line with creating that impact that various governments and various international funders and various philanthropies are trying to achieve. So that's really been my journey. And today, speaking with you, I'm representing PATH and all the work that PATH does, not just in the digital health space, which we might talk about considering NASCOM's primary focus, but also in the health system strengthening space, in the immunization space, in diagnostics, therapeutics, and all sorts of very technical areas as well. So looking forward to our interaction.
Okay, thanks for your opening comments, Ankur. We've done some recent research on the Indian healthcare sector, and what we found is that even though the government has been focused on healthcare in the recent past, we are still behind when it comes to countries across the world. But want to hear your point of view here. Can you give us an overview of where India's healthcare landscape is today, including the current state of tech adoption, and how have Indian hospitals, clinics, organizations that you work very closely with, benefited from technologies like cloud, digital health records?
I think a very important point there, Chika. I think Indian healthcare system is quite complex. It's a mix of both private and public healthcare system, and also then you add a layer of urban versus rural. It complicates the situation quite a lot. While 70% of the patients do get taken care by private sector in the urban sector, uh, rural sector is largely catered by the public healthcare system. So I think it's important for us to understand that when we compare Indian healthcare system and its progress with the world, the complexity and the scale of Indian healthcare system is just at a different level. Having said that, I think India has done exceptionally well in this space, and the reception or the uptake of digital health as such by the healthcare providers has been tremendous in the Indian healthcare system. And that has been, as you mentioned, organizations like PATH have been pivotal in helping various stakeholders on the ground in making sure that that uptake is very positive. But also kudos primarily to the government that has come up with very integrated programs like Ayushman Bharat program, the National Health Digital Mission, or as it's now called ABDM, Ayushman Bharat Digital Health Mission, that is trying to promote all the aspects of digital health integration into the traditional way of how the healthcare was practiced in India. So I think the sector is doing really well. Cloud computing is getting integrated into various different healthcare systems because the data infrastructure otherwise is not up to mark. You can't really install data centers in various different places and ask hospitals to connect their databases with those data infrastructures because one, those data infrastructures are currently not at appropriate levels. Second, the hospital sector itself is not ready to have that sort of an integration, and that's where the cloud computing is offering an alternative where various hospitals, both private and public, are accepting of the system. Then integration of AI. I think AI it is creating a lot of difference in how healthcare is not just managed but also delivered. And both again private and public care players have been very receptive of accommodating AI in all sorts of routines of the healthcare, whether it is patient management, bed management, supply chain logistics management, staff deployment, etc. So I think it's a little bit difficult to compare Indian system with other countries just because the diversity, the linguistic complexity, and everything is just at a level which needs to be addressed separately.
Yeah. So what I'm hearing from you, Ankur, is that you think that India is making significant strides when it comes to deploying digital solutions. And you did touch upon AI. I want to quiz you a little bit further on this. What role do you see AI play in the future of India's healthcare system? Talk about some of the challenges that you see organizations facing in scaling up AI, and how can these challenges be addressed? What are the practices that you can?
So I think AI is something that first of all scares a lot of people, while it should not scare a lot of people. So it is important that the way AI is pitched to the traditional healthcare systems is done in a simplified manner. And I think PATH again has been doing quite a lot of work with the government in making sure that AI is not something that is really daunting or haunting the healthcare providers, and they should be open to integrating the systems. Now, AI has been helping government in improving their epidemic pandemic preparedness systems, in improving their early warning systems, in improving their diagnostics capabilities. In many cases, the patient to doctor ratio is so huge that without the integration of AI, it will become a nightmare to really address the footfall that we see in our hospitals. So not just that, but also as I previously mentioned, the integration of AI in hospital management systems, whether that is allocation of beds to the patients, really doing a proper forecast for diseases that hospitals and systems, not just the hospital systems, but public health response systems should be prepared for, is all that AI is trying to integrate. Just to give you an example, we have been working with ArtPath, which is an Indian Institute of Science AI-based platform that takes all the data of meteorological department and disease data and outbreak data from different blocks and cumulatively gives a forecast of where particular vector-borne diseases may happen. And what those forecasts do is that they prime the healthcare system, they prime the government to allocate enough resources to really tackle the situation head on and actually prepare for the situation so that the situation doesn't get worsened. So the outbreak can be stopped in its tracks so that patient management can be done in the most cost efficient and most efficient in terms of delivery in manner as well. So I think AI is creating all of that difference that will overall, help the Indian healthcare achieve its bigger mission of being part of the developed India and we're aiming for.
So then I think the opportunities that AI presents for healthcare in India are huge. I wish adoption was a lot better, but that's something that we found out. But Ankur, you did touch upon the overall developed India story, and this is a vision talk, and we cannot but help talk about India's healthcare vision for 2047, which is Swasth Bharat, right? That utilizes technology, infrastructure, and specialized talent to make India a leader in affordable, accessible, and advanced healthcare by 2047. I mean, only a healthy India can be a developed India, otherwise it's not going to happen, right? So, do share your thoughts on that. How do we as a country go about it, including building the national health stack? What role do entrepreneurs such as you play in achieving this ambitious vision, specialist organizations such as you play in achieving this vision?
Very important. I think the Viksit Bharat mission of Prime Minister Modi that sees India becoming a developed country by 2047, 100 years after independence. Swasth Bharat, as you said, Swasth Bharat 2047 will play a critical role in achieving that Viksit Bharat aim. And I think that Swasth Bharat is really trying to provide universal health coverage for all in India, because without a healthy India, a developed India will be a goal too far. So I think we have to make sure that all the ambitions and tracks that the Swasth Bharat mission has laid out, whether it is in the digital health space or whether it is in just integration of Ayush, which is the traditional medicine space, into the Indian healthcare system, with evidence-based backing has to be done. Absolutely, it has to be done. Now, Swasth Bharat is working in several streams. One of them is training the future workforce, because the current workforce may not be appropriately trained for meeting the ambition of 2047 developed India or Swasth Bharat. And so, therefore, integration of digital curricula in the training of current healthcare workforce, not just the clinicians but also the nursing staff, also the support staff, also the admin staff that will support hospital system management, etc., has to be done today for that to be visible in 2047. Then the other thing is the climate change integration, because we are addressing the climate change angle at the same time as the health workforce training. So we are also working on the telemedicine aspects, not just to improve the efficiency of the healthcare system, but to cut down thousands of kilometers that people, sometimes from remote areas, have to travel to get access to quality healthcare. So we are not just providing them the healthcare through the Swasth Bharat ambition through this telemedicine channel, but also cutting down on the climate greenhouse gas emission. So that's that. And then also another important point that Swasth Bharat 2047 is focusing on is the mental health integration. It's an area of non-communicable disease that often gets overlooked, or especially in the Indian cultural setup, it's an issue that generally gets sidelined. So the government is really trying to bring a lot of focus on that area so that as we move towards being developed, the stress levels and the hard work that everybody would have to put in would have to be addressed through proper recognition of mental health agenda as well. So there's quite a lot that the government is doing to, as I said, the social economic mission that government is trying to deliver will take Swasth Bharat agenda as a critical component in its
Yeah, I completely agree and good. We talked about how India has emerged as a leader in some pockets of innovation for healthcare. Um, and also, can our experience serve as a role model for other countries developing as well as developed countries, particularly in the global south?
So I think India, especially through the G20 presidency that India recently had, has really come out as a leader for the global south. And India has been very open to sharing its technology, its wisdom, its learning, and its experience through the journey of being now the fifth largest economy of the world with all of the global south players. And this holds true in so many sectors, and it is also now expanding in the health sector as well. Finance sector, in particularly, we've seen a lot of traction in that sector through the DPI, for example. In the health sector, India can offer the world knowledge on how to be be of quality, but still be affordable. And because of the diversity that India offers and the unique challenges that India offers, which are very similar to what a lot of other countries in the global south face. Some global south countries have very remote populations, same we have in India. Most of the global south countries have limited resources, same applies to India. Most of the countries in the global south have workforce that is not as well trained as it should be for being a developed country. India has the same issue and we are tackling that head on. So I think a lot of areas where India can use its learning, share its technology, whether it is telemedicine platforms, whether it is technology transfer in the vaccine space, whether it is technology transfer in the other medical countermeasure space, or whether it is sharing and exchange of the R&D innovation hubs. If you take the startup ecosystem for that matter in India, it is one of the largest in the world, and India can really play an exemplar role for the global south to learn from and actually come to India, take the information, take the knowledge, and go back and implement in their own countries so that the overall global south can benefit from India's experience. And then India can also then in future benefit from that south-south and north-south partnership that will be encouraged in the process.
We've seen our DPAs go international, our health stack, our health activities that we do. Do you see opportunities beyond global south also? I mean, what would be your top 3-4 countries you think that they can definitely benefit from what India has done, given that you're looking at a lot of international markets?
Yeah, thank you. I think DPIs have been a real success for India, and as we've all seen through media and through news, social channels, etc., that not just the global south but also global north has had a lot of traction in how India has been able to achieve the UPI, for example, Unified Payment Interface, and how that is now being opened up to the world through India's digital public infrastructure program. But remember, any digital public infrastructure is as good as the digital public goods that it can host. So, and those digital public goods would have to be slightly different for slightly different settings. It may be if France is taking one of our DPI platforms, the TPGs that they would have to build on that would have to be slightly different to suit their culture, their way of working, their language, their systems, etc. And so I think while India is offering it to different countries, I think different countries have to remember that you can take the baseline technology, you can take the baseline knowledge, but then you go and adapt it as per your local best implementation. So PATH recently also launched a Global South Research Collaborative Initiative, for example, where we are simplifying some of these complex pieces that people may not understand. And we are saying that take the simplified knowledge, use it to have as a baseline, and then build complex products, complex services to suit your own system. And there has been a lot of reception to that, and a lot of global South countries, whether that is in Africa, in Latin America, in Asia Pacific, etc., are all very, very keen on taking all the learnings that we are doing.
Great. Last question, because I know we are out of time, but three things that you would like to leave our audience with, given that healthcare as a sector requires patience, innovation, right? In equal order. What are some words of advice for entrepreneurs, organizations that are in the healthcare space? How to become more impactful, become more successful in this?
So I think the three things I would say is India is already a fantastic entrepreneurial ecosystem. The startup ecosystem is fantastic. I think people have to understand that they should not try and do things alone. Government is very open to the model of public-private partnership, and there are several schemes of the government that innovators and entrepreneurs can explore, not just in the health sector but in other sectors as well. So be open-minded on those platforms, because the systems have become quite a lot more efficient and interoperable. Second is be patient, because healthcare is a heavily regulated industry, so you have to make sure that you are complying with all the regulations. AI, for example, the regulatory is currently being drawn, being discussed, so you have to be open to, to be flexible enough that if the regulatory says something different from what your product is currently sticking to in terms of guidelines, you have to be open to quick adaptation. So that is what I would say for the AI entrepreneurs. And finally, I would say that work for human life impact, because that's the ultimate goal that both the governments and you are trying to achieve through what you're trying. So think beyond the product. Think how your product is going to improve the human lives, and in the process, if that, for that matter, if it is healthcare sector benefiting, if it is social behavioral platforms benefiting, if it is mental health platform benefiting, or if it is AI platform benefiting, eventually what sort of human impact you're trying to create is the most important. So those, I would say, would be my three key suggestions.
Okay, so for the viewers, I think it's a matter of 3 P's. The first is be partnership focused. The second is be very patient, and the third is find purpose, which is basically human impact that you are able to create. So thank you, Ankur, for sharing such valuable insights on health equity and the transformative role that technology can play. On that inspiring note, we conclude this episode of Vision Talk. We'd love to hear your thoughts in the comment section. Don't forget to like, share, and subscribe to our channel for more thought-provoking conversations with industry leaders. We'll see you in the next episode, and until then, stay tuned.